Okay. Hi, my name is Brenda Jagatic, and I'm the Diabetes Education Coordinator at the Indiana State Department of Health. And today we're here to share with you that 1 in 3 adults in Indiana have prediabetes. And we're here because today is Diabetes Alert Day, and we want to help educate people to know, are you at risk for developing prediabetes or type 2 diabetes? And just to give a little plug for the Indiana State Department of Health, we have a website, and I'll show you my little poster here that describes it. It says 1 in 3 have prediabetes. And our website is www.preventdiabetes.isdh.in.gov. And if you will go to our website, you can take the risk tests that can help to see whether you're at risk for developing prediabetes.
Perfect. I'm Ashley Meredith. I am a clinical associate professor at Purdue University's College of Pharmacy, and I'm here just to represent the diabetes educators, the pharmacy side of things, because medication does have a role in preventing the development of diabetes if you're identified as being in that pre-diabetes population as well.
Hello, my name is Vanessa Summers. I'm a state representative from here in Indianapolis. I authored a piece of legislation that we're going to talk about, but I have another hat. I work for the Indiana Minority Health Coalition, and we do the National Diabetes Prevention Program. So we're going to talk a little bit about what we do here.
Hi, my name is David Miller. I am a certified diabetes educator for Community North in Indianapolis. I'm representing meal planning and exercise and behavior changes that we can work with our patients to help them have better control of their blood sugars.
Hi, my name is Tamara Hannon. I'm a pediatric endocrinologist at Riley Hospital. That means I take care of children with diabetes, but as my job through the university leads me to diabetes prevention, and I do that both in pediatric populations and adult populations.
Perfect. So we have a pretty diverse group here, and just for people watching on Facebook, again, I'm starting to see some people commenting questions. As those roll in, we'll make sure we get those to you guys. So if you want to start us off again,
Okay,
what
so
we're doing today.
one thing that's really important to know, so we know that 1 in 3 individuals have prediabetes, but the important piece is that within 5 years, 15 to 30% of those individuals will develop full-blown type 2 diabetes. So we're here to talk about diabetes prevention programs, and actually we have 96 diabetes prevention programs across the state of Indiana. And remember, I talked about our website. When you go on the website, you can take the test to see if you are at great risk for developing prediabetes, but then also on our website we have a list and locations and contact information for those 96 diabetes prevention programs here in Indiana.
We do have a viewer question real quick from Patsy. She's saying, is it true that it's hereditary? I know that's a very broad question, but can anyone speak to that?
Can I speak to that?
Yeah.
Especially in the African American culture, we find that African Americans tend to be comfortable with diabetes because culturally their aunt, uncle, cousin, mother has had diabetes, and they're comfortable with it. So if they lose an eye, and you can lose an eye being diabetic, if you lose an appendage, they're comfortable with it. So we need to break that stereotype. Yes, if your mother was diabetic, if your brother was diabetic, then your risk goes up.
So the genetic risk is hereditary.
Mm-hmm.
It doesn't mean that if you're born with a genetic risk that you're absolutely 100% going to get type 2 diabetes. Just means that you're more likely to. So you're right, if you have a first degree relative like your mother or your brother, or a second degree relative like your grandpa or your grandmother, then you're at increased risk because of your genetics.
But I think what we're here today to talk about is that if you're at risk, please take the risk test to find out, and then know that if you get enrolled in the diabetes prevention program, you can lower your risk for developing full-blown type 2 diabetes. So we can't change the fact if there's a family history. We also know that people of color are at greater risk, and we also can't change the fact that if you're over 45, you're at greater risk. The things that we can change, that we focus in on the diabetes prevention programs, is changing how you eat and becoming more active.
Perfect. Can we jump to that? As a couple of people are asking about
processed sugars and
Oh.
what to eat in the morning and stuff. I know you're going to talk a little bit about
Sure.
diet, if we could jump into that.
Absolutely. So with people with prediabetes or diabetes, what we want to work with them is counting carbohydrates. So a lot of people look straight at the sugars, but really we're more interested in carbohydrates. When we eat, food's broken down into three things: fat, protein, and carbohydrates. And carbohydrates are the ones that really affect your blood sugar. So those are the ones we want to work with our patients on, as far as counting carbs with each meal, how many they can have with each meal, and so that they can mix and match. They don't have to give up food. They can still have their ice cream if that's what they want. We just have to work it into their meal plan so that they're counting that carbs.
I think the other thing too, in terms of when we're looking at trying to prevent diabetes, I think it's important for people in general all across the state, we need to eat more fruits and we need to eat more vegetables. The recent study showed that 11% of people in Indiana get the recommended 2 servings of fruit a day, and 7.3% of people living in Indiana get the recommended vegetables 3 servings a day. So it's a combination of eating more healthy. When you have diabetes, you definitely have to look more at carbohydrates. But in general, in terms of reducing your risk, it's also important to eat more of the plant-based foods. Also, maybe not as much as processed, as much as fast foods.
That's a good point. What we find is that we have a couple of generations that don't know how to cook. They have no idea what fresh food is, fresh vegetables. You put it in front of them, and if they don't know what to do with it, then they're still not going to be on the road to a healthier life. We've been on a fast track, fast food relationship for years, and so it's kind of hard to stop. You know, I was telling them that I backed into a weight loss challenge recently, but I had to stop eating processed food. That was hard. It was like an addiction, you know, like sugar and fast food, and just going to, you know, a fast food restaurant. It was so much easier, even if you think you're getting the healthy choices.
Mm-hmm.
But we also do know that one of the takeaways is that people believe that eating healthy also is more expensive.
Okay.
So, you know, you have to dispel that and give them tools. Don't you tell them that if they wash the canned vegetables, then they're okay. I mean, you know, the little tricks like that we have
To reduce the salt.
to reduce the salt,
Yeah.
you know, out of the can.
Yeah.
You know, so they can still eat that if they couldn't buy the fresh green beans. You know, so you gotta tell them.
Yeah, and what you're really sharing is part of what the diabetes prevention program is all about.
I live it, so yeah.
Yes, the diabetes prevention program is a year long, and some of you think, oh my goodness, that's so long, but what you're describing is it's really hard to change eating habits. It's really hard to become more physically active. So the program is, for the first 6 months, you meet once a week for an hour, and then the second 6 months, you're going to meet once or twice a month for 6 months. And again, the reason why it's so long is making these changes are hard, and going to these classes, you are going to learn information, you're going to learn how to set goals, but most important, you're going to get support, because making these changes is difficult. And maybe you can speak more to that, since you're familiar with the diabetes prevention program.
Well, you know, we are part of the state's, the Indiana Minority Health Coalition is a part of the state's diabetes, NDPP. And what we find is, yes, change your lifestyle, change your life is a very, very hard thing to do. You have got to make a decision that I'm gonna step away from this, this, and this. I'm going to cook. I want to put exercise in my life. So when you tell people, we need you to put 150 minutes of exercise in your life, that is daunting. But then you got to break it down for them. Walk your dog. You have a dog, walk your dog. You have friends, go to the mall, walk the mall. You got to kind of back them into exercise, because if you say exercise, they look at you like a deer in headlights, like, I gotta go to the gym?
Just to clarify, the 150 minutes is across the week.
Yes.
Yeah.
Oh, yeah. I was getting to that. 150 minutes across the week. 30 minutes a day for 5 days, so that means you still have 2 rest days. But even that is daunting for some people. So during the program, what we did was we went to what they liked. They like to line dance.
Awesome.
That's fun.
Give them, it's fun. It's an hour. They don't realize that they've sweated and they've moved, you know. walking clubs. Some of our members they didn't know each other before, but they walk every day, you know, because we have some seniors in our group that maybe have not joined Silver Sneakers, you know, so they get together and they do things together, but it's a daunting process. We also found out that you have to teach them to read labels. You got to teach them how to shop the grocery store. You can't take somebody that hasn't been going to the grocery store and just drop them off at the grocery store and expect them to come out with healthy food. They're not gonna do that.
I think there's two. I'm sorry. I
Go
think
ahead.
there's two things. One, you're right, 30 minutes, but it doesn't have to be 30 minutes all in one block.
Oh,
It
no,
can
that's
be
true.
10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes at night, and you're going to get the same benefits. And going back to what you said, Brenda, about the program, it's not only making those changes, it's maintaining those changes. Because gravity pulls us back so easily that we can do it for a while, but then that gravity starts pulling us back to our old way. So it's not just making the changes, it's continuing those changes so it does become a lifestyle.
Well, and one thing that can help you is sort of the diabetes prevention program, the community, and the support from the other members, because studies have shown that when you hang out with friends who have the same habits, who have the habits you want to emulate, you can be more successful. So if I'm hanging out with my friends who maybe want to, you know, go out and eat pizza every night, I won't do as well as if I'm hanging out with my friends who have the same goals.
The other thing I was gonna say, which is kind of exciting from the perspective of the state, Indiana State Department of Health, is that in terms of preventing diabetes, it takes a village, so to speak. So that the diabetes prevention programs have been in collaboration with local YMCAs across the state, physician groups, hospital systems, and community programs like yours. But the one thing I wanted to make sure I shared with you is what is the goal of the diabetes prevention program? The goal is to lose 5 to 7% of your weight. So that if you're weighed 200 pounds, that would be lose 10 to 14 pounds over that year and then maintain it. And the other thing is, like you said, the 150 minutes per week, and like we said, that you can break it up into small pieces.
And as we're here on Facebook Live, we're getting a lot of specific questions, but I want to take it back to a few viewer questions we had earlier about the two different types of diabetes and distinguishing between those. A few people have said, you know, can you guys just explain the difference? Some people, you know, it's obvious, but could one of you kind of explain the difference between type 1 and type 2? And I know today we're mostly focusing on type 2.
So, I mean, I think all of us could speak to that here. Type 1 diabetes is, you know, that is genetically driven. You're born with it. It's not a lifestyle. It's not anything that you can necessarily change your risk factors to prevent that from happening. In type 1 diabetes, you know, you're not making as much or enough insulin at all, so you're required to use medications to manage it, versus type 2, which is the one that's most common, increasing in prevalence across the state of Indiana, across the country, and that's the one that's more related to diet, lifestyle, risk factors that are potentially modifiable, as opposed to type 1 diabetes where you can't do much to prevent that.
Perfect. And so for Diabetes Alert Day today, we're talking about type 2, risk factors, things we can do to make lifestyle changes, and there are places around right now where you can go and get tested for these risk factors, correct? Tested for things
you can go online. There's a simple tool on diabetes.org, which is the American Diabetes Association website.
Yes, we'll shoot
you
up
can
here.
see it's being held up over. It's a simple, you know, checkbox, add up your score, and based on the different risk factors, you can see how at risk you are of developing diabetes.
Then if you are at risk, then you just go to the doctor. You have a simple finger stick. If you get over, okay, we're talking about diabetes. So if you get over 6.4, right, then
So pre-diabetes is 5.7 to 6.4. Yeah,
right.
And that's the A1C test. The A1C test is a test that gives you what your average blood sugar is over the past 3 months. The other test they can do is fasting blood sugar, and the indication for prediabetes is if it's between 100 and 125. Higher than normal, but not yet met the criteria for type 2 diabetes.
So I think it may be good to mention the symptoms of uncontrolled diabetes.
Yeah.
And those include feeling very thirsty all the time, having to go to the bathroom a lot, having to urinate a lot because the blood sugar is high and you're having to get rid of it through your urine. Oftentimes children who present with diabetes present with these symptoms because they're more likely to have type 1 diabetes where they're not making insulin. So just so everyone knows, if you're having weight loss and those symptoms, talk to your doctor right away.
Yeah, and I think the unfortunate piece of the relation to children is that we used to, most of the time, we saw type 1 with children, with something
Yeah,
that
we're
they're
seeing
born with, and there's a trigger and you develop type 1 diabetes and you're on insulin for the rest of your life. But unfortunately, we're now seeing more and more children with type 2. And so type 2, lifestyle has a big factor in the development of type 2 diabetes. And we're now seeing it in children because we're changing, as we talked about, more fast food, but also looking at levels of physical activity. We sit more as a society, we're in front of TVs, we're in front of computers, so it's now affecting children, which is very disturbing.
Well, when you do affect the children, then what we found is that we've got to deal with the adults that are feeding the children. The children are not.
They can't go to the grocery store.
They're not going to the grocery store. They're not cooking, you know, so then there's a whole new dynamic because I don't know, but are most kids that are type 2 diabetic, are their parents type 2 diabetic?
Yes, about 9 out of 10
Wow.
children with type 2 diabetes have either a parent or a grandparent with type 2 diabetes. So you're right. The vast majority of children who have diabetes have type 1 diabetes. But it is correct to say that in the past 3 decades, we noticed that adolescents have been getting type 2 diabetes. And this is because of the epidemic of childhood obesity and the genetics that they have that make them at higher risk. When you put that together with the environment of having access to maybe unhealthy foods all the time and very little physical activity, you have type 2 diabetes.
And that point is just a quick point that it's healthy food access to. So, you know, that's an issue, especially in areas that don't have where you can walk to a grocery store. You know, so, you know, first of all, they don't know what to do in the grocery store. They can't get to the grocery store. And then they don't know what to do when they get there and how to eat, how to cook. So I think that we're at the beginning of a learning curve that we really got to start from the beginning. What I found out during the program is we've got to teach them we have to go to the grocery store with a nutritionist to show them the way around the store and the pitfalls of some of the things that they could decide to get. So it ends up being a whole lot bigger. It's a whole lot bigger than what you think, because one thing will happen, it's kind of domino, then you got to teach this, then you got to teach this. So you end up learning that the learning curve, you add a lot to that year.
And one of our viewers was asking, is type 2 reversible? Say you go down a really bad path and then you turn your life around. Will you have diabetes the rest of your life? Will you have these symptoms? Is there any way you can change that?
It's not reversible. Once you have diabetes, you're always going to have diabetes. Now, it can be controlled diabetes because you're eating healthy, you're counting your carbs, you're being physically active, and doing all the things that you can do to change that. But once you're diabetic, you're always going to be diabetic. You're just going to be controlled versus uncontrolled.
So what's different, though, is with pre-diabetes, why this risk alert day is so important, because if you know you have pre-diabetes, you can reverse that.
Right.
But then there's a point of no return.
And also important to know that when you have diabetes, you can be improving your eating habits, improving your physical activity, and then, you know, also you can be using medication, but there's things that you can be doing so that your numbers are within the normal range, even though you still have the definition of the diagnosis of type 2 diabetes.
I'm the best example of that. I went to my endocrinologist yesterday, and my numbers were good.
Yay.
She was very happy. She would listen. She battled with me for a while. I'm not even gonna lie to you. I thought she wanted to dance, you know what I'm saying? She battled. You know, I'll just decide all of a sudden I'm not diabetic, and then I'll still take my medicine and everything, but I'll just eat whatever I want to. So, you know, it's a curve and it's a decision, and yeah, it's hard, you know, especially if you're full blown and you're diabetic. But I believe that in the pre-diabetic, like you said, if you work hard, you can change. It does work. It does reverse. We've seen great, for example, in my program, we had one lady that ended up being diagnosed with cancer. but she had been in our program and had lost some weight. So everything was better for her for surgery and recovery, because she had done, those things. So we do have some good stories.
Yeah. Can you talk to us about what people should be doing today to talk to their doctor, the types of questions they should be asking? Where's a good place to start? If someone's watching this today, a lot of people are saying this is a great conversation, now what do I do?
I would go to diabetes.org
Yeah.
and take the risk assessment and keep your answers and take those to your primary care provider or whoever you see.
Get your A1C.
So then they can follow up to see if you need more blood work to further diagnose.
And I just want to put in a plug for diabetes educators. So it's not just doctors or physicians that can provide this information and this education. There's a whole group of providers that practice under different disciplines. I am a pharmacist, David's a nurse, there's dietitians, there's all sorts of healthcare providers that have gotten specialty certification in diabetes education, and they are also great resources to help beyond the physician as well.
I think the other thing I would even say, even if you don't have diabetes or if you don't have prediabetes, but you probably should be making some changes, you can talk to your physician about seeing a dietitian to help make changes in your eating habits. And, I was thinking what we were saying about children, like things like some little tips that you can do, for instance, like when you go grocery shopping, don't go grocery shopping when you're hungry, because you're more likely to buy.
Well, that's the worst.
If at all possible, don't go with your children, because children are gonna be bugging you to buy the food.
$20 more on the average.
And one of the new things we're seeing is that we're seeing some grocery stores that are offering delivery. And so in some ways, I've heard some people say it makes it easier because I'm not passing the cookies and I'm not at the chocolate bars, and it makes it easier for me to stick to my plan.
I do the delivery for myself, and I will say it makes it so much easier. I do my list, and that's what I get. There's not that extra. There's not the, oh, that sounds good today, let me add that in. And I mean, it's a great service to help keep it focused.
I think too, Brenda, it's important to know too, how often do we drive around the parking lot waiting for that spot right in the front?
Park for the
We can park in the back, park in the back,
and walk.
right, park in the back and walk in.
And I think the thing too is, if you went to a diabetes prevention program, is that keep your goals small. It doesn't have to be huge goals. Start small and build on them so you can feel confident.
I find that during the program, in the beginning, they look like deer in the headlights because you're taking my stuff away. What do you mean I can't? So it is part of, they know they have to do it. They don't want to do it, but they know they have to do it. So you'll battle with at least 6 weeks with that. They may show up to the class, but they may not always be completely invested in it, Now, I'm going to tell you, it's better when we have physician referrals. We had one physician, I think he scared his people. That was okay, because we got plenty of classes, and we help people lose weight, we help people get their road to diabetes diverted. So, that was okay.
Yeah, because I think it's when your doctor knows you're going, then they're going to follow up you. So it's a
Right.
little bit more accountability. But I guess it's also important to know that for diabetes prevention program, you don't have to have our doctor's referral to attend. But I
No.
still think it's good to be engaged with your physician to let them know what you're doing.
I think as a physician, if with a person who's ready to make changes, you can nudge them over the hump. I'm not one for scaring my patients. Some doctors are very effective at that, but scare.
Well, when I say scare, I don't mean like the nudge, but
The
maybe a little
nudge.
stronger nudge than
Right. The
than
nudge.
than a gentle lady.
Because when it comes down to it, it's the person who has to do it, or it's the family who has to
They're
do
doing
it,
the hard
right?
work.
Yeah, and it's it's.
That is a hard decision.
Yeah.
It is a hard decision. It's a hard decision as a person that just had to do it. It's extremely hard. But can I talk about? I do need to talk about one thing, and that's
Yeah.
House Bill 1175.
Yes, let's
that-
talk about that.
Yay. So what that means is that we now will have a strategic plan with all kind of partners coming together to the table to come up with what we should do around the state of Indiana. We were helped by the diabetes educators, the Diabetes Association. We all came together and said, we don't know the statistics. Even though we were doing NDPP, we don't know the statistics. We know nationally there's 26 million diabetics, but we don't know how many are in Indiana. We know that there may be 500,000, and that is like the size of Fort Wayne from what we say. So there's got to be a plan for those 500,000 people to help them, and the others, you know, I kind of think that we've been a little comfortable with diabetes, and some of us need to be scared.
But I also think it's exciting that you're getting different stakeholders involved.
Right,
Because, you know,
we're all coming together
It goes back
to see what everybody's doing.
Because one of the things even within my job is looking at, so I'm supposed to increase diabetes education, but also looking at when someone goes through a diabetes education program or the DPP, are they getting support from friends, family, workplace, their community? Like, for example, at the Indiana State Department of Health, we have some things in place in terms of health and wellness. Like, we have a fridge and a microwave. So it encourages people to, you know, to bring in a healthy lunch as opposed to just going down the street and having a hamburger and fries. They have prompts to take the stairs. So that they have yoga class on site, they have exercise, you know, minimal exercise equipment. So sometimes also looking at what workplaces can be doing. Because let's say you've gone through the DPP program, but at work, once a week they have coffee and donuts, and you love donuts. I mean, looking at to get support so that the healthy choice is an easier choice rather than having donuts. Maybe they could sometimes have fruit as a snack.
Yeah, then they'll come in and go, where are my lungs?
So maybe be careful and maybe have a bit of both. But it's just looking at that people who are really wanting to make lifestyle changes, they need support from within their greater community.
And what we've had some funny stories of people that are married and their husbands like, what are you doing? So we said, look, sneak the food into him, you know, change hamburger to turkey, season it real well, don't tell him, you know, and see what happens. And we have had plenty of people that have made subtle substitutions in what they make and how they make it. And because sometimes your family's like, I don't want to change, you have to do that, I don't have to do that. You know, unless they're both on a bad, healthy ride, that's a family dynamic is a hard one.
So you give a really good example. Sometimes people think that they have to change everything, but what I know that I see frequently is that families change one thing, and one thing you can do is stop the sugared drinks. If you stop the sugared drinks, I've seen people lose 10, 15 pounds just with that alone, bring their hemoglobin A1C down to normal. So sugary drinks are, for kids, the #1, and probably for adults,
I was going to say soda pop.
the #1 source of added sugar to the diet. So yeah, I mean, little things add up, but stopping sugary drinks can be huge.
And then replacing it with water, because
Yes.
water is so great for you. And then, you know, like sometimes you go into hotels and they have water where they've got little bits of fruit in it. So why not have something in your refrigerator that's got some lime or some different strawberries and blueberries, so that you're drinking, it's healthy, but it makes it a little bit more interesting for people who say, oh, well, I don't like water.
When you said that, it comes to one of our stories. We had a lady that drank 8 Pepsis a day, literally. Because, okay, in the DPP, we ask you to track your food. We want you to write it down so that we can see what you're doing. She was drinking 8 Pepsis a day, so we had to give her suggestions. She lost weight just by getting this, like you said, just by stopping so about 8 weeks in, she had stopped the soda and was drinking anything but water, but the group dynamic helped her. You know, every time that we meet once a week for an hour, how many Pepsi, how many Pepsi, how many did you have this week? You know, so, you know, you're getting that people, you're in a group, they're caring about what you're doing, so that makes you go home and decide, maybe I won't do this. But, so the DPP and the group dynamic is really, really a very good situation.
I love that example, because if anybody who's out there listening and also drinks 8 cans of pop, the thing is, you don't have to go from 8 to 0.
Right.
You could go from 8 to 6 for a couple
And
of weeks.
just, put the water,
do it
replace it with
slowly.
the water,
Yeah.
right? That's what we ask.
Yeah, make it
Change,
easier.
lifestyle change is not an instantaneous. Lifestyle change your life. It is, let's read, like you said, the program that we are talking about, it's a year. Now, in my case, it took about 3. But But for
Persistence.
persistence,
And
but
that's the
knowing,
important thing.
yeah, the persistence, then you stop wanting some of those things that you wanted before. You know, you really do. You really,
They don't taste as good as I remember.
I don't
Real
know.
quick,
Taste
can
is
you guys
good.
give out the diabetes prevention programs, like the websites and different places that you guys work with that could, a couple viewers are asking for this?
Well, maybe what I'll do is, because I showed
Hold that
my
up again.
poster at the
Yes.
beginning, but people may have come in later, so.
Yes, that'd be
The
perfect.
Indiana State Department of Health has put together, we have 96 sites across the state that have diabetes education programs, and we know 1 in 3 have diabetes, and 15 to 20% of those individuals with prediabetes are likely to develop diabetes in the next 5 years. So if you were to go, so we have 2 sites, and I'm gonna promote the state, and then we'll go back to promoting the American Diabetes Association. So the site is, it's, I'm going off track here. It's preventdiabetes.isdh.in.gov. And when you go to this website, there'll be you can take the risk test, but you can also find the locations of the diabetes prevention programs for yourself.
I have a number.
Yes.
For our program. We are part of the State Department of Health. Ours is called Change Your Lifestyle, Change Your Life. Our number is 1-866-CYL2-DPP, which is 295-2377. 866.
Community Health also has outpatient diabetes education program as in IUS.
Yeah, so we should also say that the American Diabetes Association has a website that's very useful, www.diabetes.org.
All right, well, I think that's a good stopping point. A lot of great conversation, a lot of great questions from the viewers. I do think we've hit everything for the most part. And then if anyone else who's watching has more questions, I'm sure we can keep commenting throughout the day, and if you guys can take a look at this and answer, jump on and answer any of those and send any links, I'm sure that'd be really helpful for people.
Okay.
So thank you guys so much for being here.
Thank
And
you.
thank you guys for joining us.